Hi, this is Alicia, and I'm doing my presentation on ulcerative colitis. Ulcerative colitis is an idiopathic and inflammatory bowel disease that causes inflammation in the digestive tract. And in this picture, you can see that this is a healthy, normal colon, and this is an inflamed colon. Etiology. The exact cause of ulcerative colitis remains unknown, but one possible cause is immune system malfunction, when your immune system tries to fight off an invading virus or bacterium. An irregular immune response causes the immune system to attack the cells in the digestive tract too. Heredity also seems to play a role in ulcerative colitis, and it's more common in people with a family history of the disease. Poor diet and exercise and stress are also known to aggravate UC. Types of ulcerative colitis. There are 4 types. There is proctitis, proctosigmoiditis, distal colitis, and pancolitis. Healthcare providers often classify ulcerative colitis according to its location, symptoms, and a lot of these different kinds often overlap. Ulcerative proctitis. This is a type where the inflammation is confined to the area closest to the rectum, and rectal bleeding may be the only sign of the disease. And this is the area right here that is affected. Proctosigmoiditis. This is where the inflammation involves the rectum and the sigmoid colon. And the sigmoid colon's right here. It is the lower end of the colon, and here we have the rectum. Left-sided colitis. This is where the inflammation extends from the rectum up through the sigmoid and descending portions of the colon. So here we have, the rectum, and here we have the sigmoid colon, and then this is the descending colon. So it's pretty much the entire left side is affected. Pancolitis. This type of ulcerative colitis affects the entire colon. So as you can see here, the entire colon is affected. Clinical manifestations. Some signs and symptoms of ulcerative colitis would be diarrhea, and it's oftentimes with blood or pus. And some people that have this can have up to 15 to 20 liquid stools a day. And with severe diarrhea, losses of sodium and potassium, bicarb and calcium ions may occur. They may also have rectal bleeding. They could have a bowel rupture or perforation. You could also see abdominal pain or cramping. They may have the urgency to defecate, bowel leakage, and inability to defecate despite their urgency. You could see weight loss, fever, fatigue, and in children you'll see failure to grow, and you might see severe abdominal bloating. Nursing assessment. Some subjective data that you might find on your nursing assessment. Your patient may complain of rectal bleeding, abdominal cramping. They may complain of lethargy, a sense of frustration, and loss of control resulting from the painful abdominal cramping and predictable bowel movements. Some objective data that you might find is weight loss, abdominal distension, fever, tachycardia, leukocytosis, and you need to observe the frequency and characteristics of the stool. Diagnostic testing. Some testing that you might find for ulcerative colitis would be a double contrast barium enema study of the intestine. You might see a sigmoidoscopy and a colonoscopy with biopsy and stool testing for melena. Some additional studies that you might see would be radiologic examination of the abdomen, serum electrolytes and albumin levels. They'll probably do some liver function studies and other hematologic studies. The pictures over here, this is a sample of a biopsy that was taken, and this is its view under the microscope. This is a picture from a colonoscopy, and you can see the redness around here and how it's really inflamed and irritated. And this is the barium enema study, and I thought it was really interesting because it you can see like the pattern around the colon, so you can see like the damage and the trauma it has on there. Drug therapy. Some medications that you might see prescribed for ulcerative colitis would be anti-inflammatory medications, for example, like 5-aminosalicylates, or you might see some corticosteroids. They would also prescribe some biologics, which would be infliximab, or Humira, Entyvio, Stelara. You might see them prescribe some immune system suppressors like azacin or Purenthal or cyclosporin, and you could see some small molecular medications like Xeljanz, and some other medications that you could see them prescribe would be antidiarrheal medications, pain relievers, and typically they are going to prescribe acetaminophen. They might prescribe some antispasmodics, and you could also see some iron supplements. Nutritional therapy. The goals of diet management are to provide adequate nutrition without making symptoms worse, to correct and prevent malnutrition, and to replace fluid and electrolyte losses, as well as to prevent weight loss. A food diary may be helpful to identify problem foods, and patients with significant fluid and electrolyte losses or malabsorption may need parenteral nutrition or some sort of internal feeding. Stress control. Ulcerative colitis is aggravated by stress. It would be important for the patient to identify factors that cause the stress, and this is actually the first step in controlling the disease. As a nurse, you should work with your patient to find healthy coping mechanisms. Surgical interventions. If an acute episode does not respond to treatment, if complications occur, or if the risk of cancer becomes greater, then surgical interventions are indicated. 25 to 40% of patients with ulcerative colitis will need surgery at some point during their illness. Some surgical interventions that you might see would be a colon resection, and ileoanal anastomosis, an ileostomy, a knock pouch, also called a knock continent ileostomy, or a proctolectomy. In this picture, this is the knock pouch. I had never heard of this, so I thought I'd include it in there. And this is actually where they have the surgical removal of the rectum and colon. And you can see there's nothing there. And they created this reservoir by suturing loops of adjacent ileum together to form a pouch. And they also formed a nipple here and a stoma right here, and you can see it drains here. Nursing interventions. As a nurse, you will want to discuss dietary modifications related to nutritional status and the presence of an ileostomy. You will provide referral to a dietitian for diet planning and teaching. You will teach the importance of maintaining a high fluid intake and manifestations of dehydration. You will teach techniques to reduce stress. You will teach food blockage management. You will also administer total parental nutrition as ordered. You may administer anti-inflammatory medications as ordered, provide IV therapy, and you may also teach them to empty and change out their ostomy bag of choice. You can teach stoma and pre-stomal skin assessment with each pouch change, and you'll probably provide them a referral to a local United Ostomy Association, and you can provide them a list with some local medical suppliers that can provide their ostomy supplies. Patient education. Some education that you would provide your patients would be to not to take NSAID medications, including aspirin and ibuprofen, because these can cause further inflammation. They need to eat a variety of healthy foods to keep their colon healthy. Foods like fruits, vegetables, whole grain, low-fat dairy, beans, and lean meat and fish. They need to be sure to drink plenty of fluids. They need to avoid drinking alcohol and smoking. They also need to exercise regularly. And they're also advised to contact their doctor if they have any of these symptoms, including abdominal pain, blood in the stool or emesis, fever and chills, swollen abdomen, or they begin to lose weight without trying. Prognosis. The prognosis is related directly to the number of years that the patient has had the disease. About 10% of people will get better after one attack, but it is more likely that you'll have flare-ups that will come and go periodically throughout your life. You may go weeks or years without any symptoms, and the longer you go without a flare-up, the better your overall health will be. You are more likely to develop colon cancer with ulcerative colitis, and the disease carries a higher mortality rate among patients who have had the disease for an extended period of time. Thank you guys for watching. I hope that you all do well on the final, and I will see you